Hey everyone, Certified Lymphedema Therapist here. Let's go step by step through a lymphatic drainage routine to help move fluid for left leg swelling and lymphedema. If you want printable handouts, check out the links in the description box down below. So we're going to dive right in, but if you have any new symptoms or pain, always check in with your doctor for clearance for safety. It's also best to do this routine directly on the skin if you're able to, and this is something that can be done daily. Everyone is going to need to find a position that is comfortable for them, but if someone is having issues reaching their leg, then pulling in a friend or family member might be helpful. So first, let's start with 4 deep breaths to help stimulate the deeper lymphatic structures. This will increase flow of lymphatic fluid through the large vessels. Place your hand on your abdomen, gently pressing inward for some pressure. Take a nice big breath in through your nose, and then exhale out through your mouth. And you'll repeat that 3 more times. After that, we want to stimulate the lymph nodes throughout the body. We're going to start with the lymph nodes that are right around the collarbone or the clavicle area, putting your hand on that area directly on the skin and doing 8 to 10 circles on both sides. All of the fluid in the body, including from the leg, have to make its way up to this area before getting back to the heart. Then we can stimulate the lymph nodes that are right below the ear on the sides of the neck, putting our hands on either side and doing 8 to 10 circles on both sides. Next, we're going to stimulate the lymph nodes in the left armpit area, putting your hand directly in your armpit and doing 8 to 10 circles in either direction to stimulate those lymph nodes. And then we want to stimulate the lymph nodes in the groin area. So we'll start with the lymph nodes on the right side, doing 8 to 10 circles. And it's right about where your sitting crease is. And then you can also do 8 to 10 circles on that left side in the front of the hip or that groin area. Then we're going to decongest the area. We want to move the fluid that might be sitting in this area out so there's space for the fluid from the leg to get through. So we're going to start from the left groin, working over towards the right groin 3 to 5 times, and also working up the side of the body from that left groin up towards the lymph nodes in the left armpit. Again, 3 to 5 times on the skin if able. Now we're going to start to work into the left leg. We're going to start in the low back and the hip and the glute area. That fluid moves around towards the front of the body, towards the lymph nodes in the front of the groin. Once we're finished there, we can start to work into the leg itself. We're going to start from the knee all the way up towards the lymph nodes in the front of the groin. We can do 3 to 5 strokes on all sides of the thigh. You don't have to press hard as the fluid is right under the skin. Nice and gentle moving up, using as much of your hand as possible. We also want to work on the sides of the leg, on both sides. And as we start to work on the sides, but also behind the thigh, that fluid is actually going to wrap around more towards the front where those lymph nodes are. So guiding the fluid up, but also up and around is going to help make sure that the fluid moves as it needs to. If someone feels any thickening or hardening, which we call fibrosis, you can spend more time massaging in that area or spend more time in any area that you might have more fluid. After you've finished with the thigh, then we're going to work on towards the knee. So guiding the fluid up and around the bone, up and around the kneecap, on the sides of the knee, and then we're going to go in the back of the knee. We can spend some time doing a few circles to stimulate the lymph nodes that are right behind the knee, and also guiding the fluid around the tendons, and that might be congested back behind the knee. Then we're ready to move on to the lower leg. We're going to be guiding the fluid from the ankle all the way up to the knee. Again, doing 3 to 5 strokes on all sides of the lower leg. You can guide the fluid straight up in all areas. If someone is able to get their leg above their heart, have gravity assist, it can move the fluid a little bit easier, but at the end of the day, it's most important to find a position that's easiest to reach to these lower leg areas and into the foot and ankle. But continuing with all areas and all sides of the lower leg, and spending more time in an area that you might have more swelling, then we're going to move on to the ankle area. A lot of fluid likes to sit around those ankle bones, so you can use your hands and your fingers to work around the bones, around the tendons, in the front of the ankle, the back of the ankle, before moving on to the foot. Using your whole hand, you can guide the fluid on your foot and as well as on your toes. If someone has more fluid in their toes, you can spend time with each individual toe to make sure that we're moving all that fluid. After someone has finished with that area, doing as much as they'd like, then we move the fluid back up the leg. So going back to the foot, and then going to the ankle, and then we start to move up the lower leg. So from the ankle to the knee, doing 3 to 5 strokes on all sides of that lower leg to make sure we're moving the fluid out of the area. When someone has finished with the lower leg, then we're going to work back to the knee, guiding it around the bone, on the sides of the knee, and then making sure that we get behind the knee to re-stimulate those lymph nodes, but also getting in between the crevices, between the tendons, and in that back of the knee, which can affect knee motion. Then we're moving it up the thigh, from the knee, towards the lymph nodes, in the front of the hip and into that groin. 3 to 5 strokes on the front and onto the sides. And then also in the back of the thigh. You can make sure that as you work in the back of the thigh as well as on the sides, that you start to move the fluid and wrap it around towards the front. Feel free to spend more time in any areas or pockets that you might have more fluid or you have some hardness or thickening going on. That will help soften that tissue, soften the area to improve lymphatic flow. After we finish with the thigh, then we're going to work up into the hip area again, wrapping that fluid around from the low back and the glute and the hip towards lymph nodes in the front. You can re-stimulate the lymph nodes, make sure that they're processing the loose fluid. Then we can decongest the area again, guiding this fluid across the lower pelvis from the left groin towards the right. 3 to 5 strokes. We can also guide the fluid from the left groin up to the left armpit, working on the side of the body, 3 to 5 strokes. From there, we can finish with 4 more deep breaths, putting our hand on our belly, gently pressing inward, taking a nice big deep breath, feeling your belly expand into your hand, and then letting your breath go. And again, breath in and out. And then completing that 2 more times. And that's a full sequence for lymphatic drainage to the left leg for lymphedema or swelling. Again, be sure to reach out to a doctor or a certified lymphedema therapist for more personalized guidance. I hope you all found this video helpful, and we'll see you all in the next one. Thanks, everyone.